So the INTRIGUE trial is a second-line study in patients with metastatic GIST who were randomized to either Ripretinib or Sunitinib in an open-label, standard, randomized study. That study did not find a benefit of Ripretinib in terms of progression-free survival, nor in overall survival. However, ongoing molecular sub-analyses are identifying certain predictors of patient outcome, such as exon 13 mutations, exon 17 mutations identified in circulating tumor DNA. Our study presented at ASCO in 2023 looked at those patients who did not have any detectable circulating tumor DNA in their blood draws when they were on the study, even prior to treatment at baseline. This was not an insignificant number of patients. In fact, it was about 23% of all the patients on the study had no predictable circulating tumor DNA at baseline analysis. Now, in that subgroup of patients with no circulating tumor DNA, we identified a couple of findings. One finding was that these patients were younger. They tended to be about 10 years younger than the patients whose tumors had detectable circulating tumor DNA on the baseline blood test. Also, interestingly, these patients that had no detectable circulating tumor DNA had a statistically significant longer progression-free survival as well as overall survival. Moreover, there was no difference in the patients who had circulating tumor DNA compared to those who did not in terms of their response to either Ripretinib or Sunitinib. So essentially, when we identify a patient with circulating tumor DNA not detected, we will know now that those patients have a better outcome, no matter what we treat them with. And in fact, they benefit equally from Ripretinib and from Sunitinib, opening the door for additional lines of therapy for these patients.